Good morning, ladies and gentlemen. It's my great honor to pleasure to brief you about the infectious disease in surveillance in China. Sorry, it's not my PPT. Go back. Thank you. It's very fast. Not first chapter. Oh, yeah, thank you very much. My presentation will focus on the three parts. Go back. Not first PPT. Not first page. So 8, okay, go back. Oh yeah, okay, yes, follow the okay. My presentation will focus on three parts as following. First, the infectious disease surveillance system in China. Second is the early warning and the response system. Third is the strategy infectious disease control in China. Cannot go over. What? Maybe this way. Oh yeah. This is. Sorry. Well, Apollo. It's not my turn. Okay. Oh. In China. Thank you very much. In China, a robust public health system will be built throughout of the country from the grassroots level up to the national level, which includes three pillars. The left pillar is a government health management authority system from the county to national level, which are responsible for health policy making and implementation. The middle pillar is a public health technology institute, including national CDC, China CDC, 31 provincial CDCs, 375 prefecture CDCs, and 3,104 county CDCs. This CDC system carries out the public health surveillance and disease intervention programs. The right pillar is about of the hospitals and public health related academy and universities, which undertake the case diagnosis, treatment, and research work. Under the county level, we have still township health care center in each town and clinics, in each village, which provided primary public health and medical service for local residents. First. Now, let's firstly see the major infectious disease surveillance system in China. The first one is a notifiable infectious disease reporting system. Notifiable infectious disease report information system, which is called LIDRIS, over 39 diseases which should be mandatory report. These diseases are classified as 3 categories according to their severity and their threats to the public. There are 2 categories: A disease, plague and cholera. There are category B, 26 diseases, such as SARS, human infectious of avian influenza, and so on. And there are category C, 11 disease: influenza, mumps, and rubella, and acute hemorrhagic conjunctivitis, and so on. And the category A, disease, plague, and cholera, must be reported within 2 hours when diagnosis. Category B and category C, you can report within the 24 hours when you diagnosis. Notifiable infectious disease reporting system in China involved over past decades, and the reporting mechanism has been improved greatly. During the period of the 1950 to 1985, only aggregate data at the county level was reported by paper mail mostly. Since 1985, the aggregate data at the county level was reported by digital file. After experiencing SARS outbreak in year 2003, a milestone change has been made since year 2004. A web-based reporting system was developed, and the data can be timely reported with internet. In this system, individual case-based data was reported from the hospital, clinics, and public health labor into data center, which this center located in the China CDC and the national level. Currently, all CDCs at different level, more than the 98 hospitals above county level, and more than the 94 hospitals at the township level could directly report the data into the China CDC by internet. And the other hospital will report the data by traditional means to the local CDC at the county level, such as telephone and email. And then the public health staff in the CDCs at different levels will regularly analyze the data in a system. As you know, timely surveillance data analyzed and reported released in one of the vital components of the public health surveillance system. In China, daily, monthly, and annual surveillance reports were regularly analyzed and released. Among them, daily analyzed reports aim to detect the possible cluster on disease, and possible aberration will be noticed and reported health authorities. The monthly surveillance report will be finished with 10 days in following months, which tend to the present the short time the trend of the disease. The annual surveillance report will show the long-term trend of disease and will finish on February of the following year. All the monthly and annual reports will be submitted to health authorities and released to public. This figure shows the morbidity trend of the notifiable infectious disease from year 2005 to 2016. 3 newly and disease including hand, foot, and mouth disease, H1N1 and H7N9, made the overall incidence rate increase each year. However, we can remove the data from this newly added disease. It's obvious that total incidence of the ongoing report notifiable infections were gently stable, which range from the 120 and from 320 to 360 per 100,000 population. As to the mortality trend of the notifiable infectious disease from year 2005 to 2016, growth rate of the annual average mortality of the ongoing surveillance disease was 5%. Days of the AIDS account for about 2/3 of all diseases, with a growth rate at about 24%. Amount of the deaths attributed to TB and rabies were constantly reduced. In addition to the positive reporting system, notifiable infectious disease, we developed enhanced surveillance system for some selected infectious disease, which cover about 27 diseases, including influenza, cholera, hand, foot, and mouth disease, and so on. This system consists of over 1,700 surveillance sentinels throughout the countries, and active carry out case epidemiological investigation, specimen collection, and lab testing. Detailed information we further collect about the cases, contacts, host, pathogen identification, drug resistance, vectors, and some risk factor, and so on. National Influenza Surveillance Network, for example, is included in this enhanced surveillance system. which actives conduct influenza like illness, IOI, and influenza virus surveillance. And both network labs and Central Hospital expanded greatly during the past 15 years, which increased the number of the labs from 6 in 2000 year to 511 in 2009 year. And the amount of the Central Hospital expanded from the 31 in 2000 year to 556 in 2009 year. Surveillance data influenza like illness and influenza virus was issued weekly. The trend of influenza like illness in the Central Hospital was figured by South and North areas respectively. From this figure, you can see we could timely identify the beginning and the end seasonal influenza epidemic season. You could also find the epidemic pattern between South and the North is different, with 2 epidemic peaks in the South area and epidemic peak in the North area in China. The surveillance data and the subtype of influenza virus was weekly analyzed and released. From the figure, we could detect the change of the dominant subtype of influenza virus, as well as epidemic period influenza virus. Then we come to the public health emergency event report system, which is internet-based also. All kinds of the public health emergency events should be reported by this system, including infectious disease outbreak, poison event, and environmental-related health event, and so on. Each public health event, once has been identified in a certain city, should be reported by local county CDC or hospital into this emergency system with 2 hours by internet. At the same time, national China CDC, provincial CDCs, and prefecture CDCs could be aware of the event and take appropriate action to respond to event according to the corresponding emergency preparedness plan. According to this data, in 2050 years, we infectious disease outbreak predominate the public health event, which account about 77%. With outbreak of the chickenpox, hand, foot, and mouth disease, influenza, MAP, and infectious diarrhea to be leading 5 years. Food poisoning ranked as the second frequentest event, followed by environment-related. As you know, early detect the aberration of disease occurrence are critical for emergency response, which could timely trigger the alert and take effective control measure so as to prevent and disease spreading and reduce new cases. Now, I would like to introduce an early warning and response system in infectious disease outbreak in China, which called called the CDAS infectious disease automatic alert and response system is active outbreak fighting response intended assistance personnel and local CDCs to deal with this thing. This CDAS mechanism work, okay, time is limited. Just for example, the CDAS useful. Okay. CDAS user is China CDC and CDC's provincial level and county level and the prefecture level. Okay. This is performance of the outbreak detection in the past year. Okay. Just another example. Last PPT. In China, we introduce different strategies that take to deal with different infectious diseases in China. First, we took strictly the monitoring measure to maintain disease eradication status, such as polio and so on, and made our great efforts to achieve the goal of the disease elimination, including measles, malaria, and so on. About the outbreak-prone disease, we made and apply preparedness plan and take rapid response to control it. For vaccine prevent disease, we developed a national vaccine program and provided accessible and affordable immunization service. And emerging infections such as SARS, H1N1, and so on, a lab-based central monitoring system were built to promote early identification and rapid response. As you know well, passengers travel across border. We have to better prepared. Let's work together to fight against these global public health threats and beat them. Thank you for your attention.